Impressive, isn't it? So, what really happens when a doctor orders a pathology test for a patient? Most people have no idea, but what I do know is that it's a fast and complex process. Over the next few minutes, we'll introduce you to the main steps involved in getting a sample collected, tested, analysed, and the results back to the doctor. So let's see what happens when patient Philip wakes up feeling unwell and goes to the doctor for help.
I've got an appointment with Dr. Jazz. Her name's Philip Hill.
Philip here?
Yeah.
Please take a seat. So how you been since I saw you last month?
I've been generally okay, but this morning I woke up to these really bad stomach pains, sort of like a burning sensation. I've been running to the toilet as well, and it's really quite painful. So I thought I'd better come and see you straight away.
That's a concern. Let me have a look at you. Your blood pressure is elevated. Can I get you on the bed so that I can have a look at your stomach area? That doesn't seem right to me. I will order some tests for you. Yeah.
Okay.
I will need your urine and blood samples so that I can have a look at your kidney and liver functions and also check your red and white blood cell count.
Okay.
Okay?
Yeah.
That will give us a better idea of what's going on.
Okay.
Take this form to the clinical lab collection center. That's the one not far away. You don't need an appointment. You just walk in.
Okay. Thank you.
Don't worry. I will call you within a week. For now, take some paracetamol and get some rest. But do come straight back if it gets worse, okay?
Okay. Thank you very much, Doctor.
Thank you.
Here's Mr. Hill. He's just arrived at the Clinical Labs Collection Centre. And is waiting for his turn. And here's the collector now.
Number 1, please come through. Good morning, my name's Malika. I'll be taking your blood today.
Yep.
Come in and take a seat.
Our collection staff play an enormously important role in the business. They deal with sick people and sometimes scared people every day. They have to make sure that the patient is properly identified and their samples are correctly labelled and barcoded. If they get any aspect of this wrong, it will impact every other step in the process, and that can have serious consequences for patients like Mr. Hill.
Could you please spell your surname
Hill.
and your given name?
Collectors need to check the doctor's request form carefully and be sure to confirm the patient's name is spelled right, the date of birth and Medicare number are correct on the form and on the samples. Then they have to collect the right tubes to ensure the tests can be performed. Each tube colour has a different preservative that affects the quality of the results. There's a lot to get right. Now that the samples are taken, the collector informs Mr. Hill that depending on how many tests are conducted and what is found, his blood sample results and an interim result for the urine should be back in a day. The full result for the urine sample will be available in 2 days, and if they find anything, the doctor will call them to make another appointment. Our collector still has a number of important tasks to carry out before she can see the next patient. It's time to get Mr. Hill back in to hear what's going on and what could be done to stop the pain he's experiencing. Doctors call, text or send letters to ask patients to return for their results.
How are you feeling today, Mr. Hill?
I'm still in a bit of pain. I've been taking the paracetamol. I've been getting a lot of rest. Hasn't really gotten any worse. Have you found out anything at all? What's going on?
Oh, yes, we have. The clinical lab has found a bacterial infection in your urinary tract, which explains the abdominal pain, burning sensation, and needing to go to the toilet a lot. But the good news is we can treat them with antibiotics and it will improve very quickly. The other good news is your cell count and your liver and kidney functions are normal. Here's the script for the infection. Be sure to follow the instructions carefully and complete the entire course of tablets.
We hope you enjoyed learning more about our work at clinical labs. We've used simple tests in this video to introduce what we do, but it's really important to remember, we also test for a range of sensitive health conditions and serious illnesses. Our work has the potential to have a huge impact on our patients' lives, and that's the main reason why we must focus on getting our work right the first time. We play such an important role in our community, and we hope you'll be proud to put patient care first in everything you do at clinical labs.